So, Dr. Hare, you've had a very illustrious career, and you started off, you went into cardiology, et cetera, but your whole schooling was at Johns Hopkins, correct?
I went to college at University of Pennsylvania,
Uh-huh.
and then I went to medical school at Johns Hopkins. And that's where in first year of medical school, that I decided to go into the heart failure field, which we'll talk about. And then after Hopkins Medicine, I did my residency there, which was a three-year residency in internal medicine. Then I did what's called the boomerang in the field, was
What
I
was that?
went away and came back.
Oh,
So I went to the Brigham and Women's Hospital in Boston, which
mhm.
is a Harvard, one of the Harvard teaching hospitals, where I trained as a cardiologist and as a heart failure transplant specialist. And I stayed on the faculty at the Brigham for a year or so. And then my mentor from Hopkins called me up one day and said, "We want you back."
Oh.
Basically, it was as simple as that.
How many years did you stay there then?
At Hopkins.
Uh,
Yeah, so he brought me back to Hopkins in 1995,
mhm.
and I stayed there till 2000, end of 2006, and I came to the University of Miami in 2007 to
Yeah,
start
this
the Stem
background,
Cell Institute.
this sunny background does not look like the Northeast, right?
Right.
And there you at Hopkins you founded also the stem cell or what was the name? Cell engineering.
The Institute of Cell Engineering. Yeah, I started the cardiovascular part of the Institute of Cell Engineering at Johns Hopkins.
Hi everybody, welcome to another episode at Biohax with your friend Dr. D. But today I have a very special guest, very dear friend of mine too, Dr. Joshua Hare. This man has done so much for medicine. He's a cardiologist by trade, but a maverick, a person that has been advancing medicine through stem cells and just mixing various disciplines. So, Dr. Hare, thank you for being here with me today.
Great to be here with you.
It's an absolute
Yeah.
pleasure. So, um, tell us a little bit about your story. So, why did you pick cardiology, and how did you go from cardiology to stem cells, and where are you today? A little bit.
So I always wanted to be a cardiologist. From first year medical school, I picked cardiology. And I think it was in large part because of the mentors I had. So I really
Mm,
respected the cardiologists who were teaching me in first year med school. And also because of the enormity of the problem. I found it so dramatic. If you have a heart attack or your heart fails,
what do you do?
it's the most important thing, right?
Sure.
So you have to, heart disease is very serious. It's got to be taken very seriously. And the idea that I could help people with that
Hmm.
and make a difference was very exciting to me as a young medical student. And so when I trained through cardiology, I picked what I considered to be the most challenging problem in cardiology, which is end-stage congestive heart failure,
Mhm.
right? So pretty much the majority of heart diseases and heart injuries will lead to a failure of the heart, and that will cause a problem called congestive heart failure. And when I started out 35 years ago, that was very difficult to treat. And we had just started to do heart transplantation in the United States. Heart
Wow.
transplantation became kind of widespread in the mid 80s. The first heart transplant was done in 1969, but it wasn't until the early 80s that it started to be adopted because the medical treatment surrounding heart transplantation took
Hmm.
a while to catch up with the surgical technique. And I became very interested in heart transplantation and end-stage heart failure, and that's what I devoted my career to. Um, and it was actually that choice that led me to stem cell.
Hmm. Now the connection I mean, you're one of the first, if not the first, to make the connection between the two, right? And I mean, and we're talking about something. I mean, you're telling me first heart transplant in 1969, and then really, let's say, took off in the 80s. It's not that old. I mean, I'm 40 years old. I was born in 85,
Yeah.
right? So uh, just remind me, I'm going to be 41. Need some stem cells. but but so it's something that's not that old. But where did you come up with the idea of stem cells and the heart? I'm sure you wanted to solve a problem. What was that problem?
Okay, you hit the nail on the head with the question. So there are about 600,000 new patients a year with heart failure in the United States. And that number has been increasing.
Hmm.
Okay. Now there are about 60 to 100,000 people of those 600,000 who it's estimated should have a heart transplant per year. Okay. And we only do 2,500 heart transplants a year in the United States. And that is because there's a donor shortage. You can only do a heart transplant with a donor. So those patients, we refer to them as end-stage heart failure. And we also say they need advanced therapies more than just medicines. So there's this big gap between people who need advanced therapies and who can get a heart transplant.
Hmm.
So about 25 years ago, the field was looking for solutions. And one of the solutions was a mechanical pump, which we developed and we use. But another potential solution was, hey, what if we could fix that heart without replacing the whole thing? What if we could just repair the damaged part with stem cells? Right? So this field of stem cells got very exciting in the 90s, and it was kind of like a logical idea. Maybe if we can find the right stem cell and deliver it to the injured part of the heart, and if that stem cell can regenerate or repair that, just the segment that needs to be fixed, maybe we can avoid the need for a whole heart transplant. So that's what I started to do about 25 years ago.
Wow.
And I was always interested in finding new biologic solutions to diseases. And so I'd rushed into this field. It was very exciting. This was around 2001, 2002, about 25 years ago.
So last time I looked this up, which has been maybe like 2 months or so, I noticed you're cited on Google Scholar almost like 70,000 times, which is a crazy number.
Yeah.
Um, for those of you not too comfortable with these numbers or too aware, it's just like saying somebody on social media has like 100 million followers or something like that. Um, so you've done a lot of work in the field of stem cells.
Yeah.
And sounds like it was, really brought upon by your quest to help cardiac patients,
Yeah.
especially on heart failure patients. Before we move on the stem cells, so just for our listeners, they're hearing heart failure. A lot of people might not know exactly what heart failure is. Maybe just we give a quick definition of what heart failure is and some of the most common reasons with people
Yeah.
with the heart failure.
So heart failure is defined as the inability of the heart to pump the necessary amount of blood to the body.
Hmm.
Right. So the job of the heart is to, from the minute you're born, even before, to the day you die, your heart is beating a certain beats per minute. If that stops, you stop being alive. So
Right.
that heart has got to pump your whole life. And the job of the heart is to make sure that oxygenated blood is getting to every part of the body that needs it, which is your whole body, right?
Hmm.
Every cell in your body needs to have a continuous supply of oxygen that comes through the blood, and it's the heart that's pumping that blood around the body continuously. If becomes inadequate because the heart is damaged and it cannot pump the right amount of blood or respond to the physiologic needs of the body, that you will develop a syndrome that we call congestive heart failure.
Mm.
It's called congestive heart failure because one of the manifestations and what people experience is congestion. They start to retain fluid, and they get that fluid retained in their legs, in their abdomen, in their lungs, so you get short of breath.
Hmm.
So a patient with heart failure is retaining fluid, short of breath, and has diminished exercise capacity. They cannot do the kinds of physical activity they want to do, and that's because the heart is incapable of sending the right amount of blood around the system.
Mm. And what would you say are some of the most common causes that we see nowadays? Some of these like superbugs to toxins to what would you say is like some of the...
It's well established what the most common cause is, and about 80% of adults with systolic heart failure, meaning a form of heart failure where the pumping strength of the heart is diminished, the systole of the heart, it's due to having a heart attack.
Wow.
Okay, so heart attack is still the number one killer in the United States. Even though that number has declined substantially over the last 50, 60 years in terms of the number percentage of people who get a heart attack, even though it's declined, it's still number one in the list of causes. And the number one cause of heart attack is still atherosclerosis and coronary artery disease. Atherosclerosis affecting the coronary arteries, leading to a blockage of the coronary artery. And when a coronary artery gets blocked and blood isn't getting to the heart muscle, that muscle will die very quickly, and muscle in the heart will be replaced with a scar. And that scar can't contract, and it makes the overall heart weak.
Now that's crazy because the stem cells can go in and reverse that damage.
In part, we haven't gotten to the point yet where we can
Complete.
completely do it, but we did a number of studies going back about 20 years ago where we worked with a company that had made a catheter that had a corkscrew needle at the tip. And we could put that catheter into the ventricular chamber, find the area of scar, screw it in,
Wow.
and inject stem cells. Well, those stem cells we started to work with are called mesenchymal stem cells. They come from the adult. So these are not embryonic stem cells. They come from an adult tissue. You can make them from a number of sources: bone marrow, umbilical cord, adipose tissue. Our favorite up until now has been from the bone marrow. We're still making in the lab upstairs that I'll show you mesenchymal stem cells from human bone marrow and from umbilical cord.
Hmm.
The great thing about these cells is you can take them from any donor and give them to any recipient.
Wow.
You don't need to, there's no tissue matching or anything like that. So what that means is you can make an off-the-shelf product. You can make a large number of these cells, put them in bags, put them in a freezer. And when a patient comes in who needs them, you take a bag out of the freezer, thaw it, and then do the injections as I described. And what we showed when we did that in patients with heart attack, that we could reduce the size of the scar about 20%. Not 100%, but 20%. But that's unprecedented.
Of
There's
course.
nothing else in medicine that can reduce the amount of scar tissue after a heart attack. And that made a difference. Just reducing that scar made a difference for those patients.
Wow. And do you guys still use the catheter or no?
We went on and we discovered subsequently that it works almost as well if you just intravenously infuse it.
Hmm.
And also the advantage of intravenous infusion is that you can give it multiple times. You don't have to give it only once. You know, to do a catheterization procedure, typically you want to do one and done. So
Right.
when we did the catheterizations, we would go in, we would do between 10 and 15 different injections, but at one time.
Hmm.
That worked very nicely. We've now gone on to do intravenous infusions, but do them one a month. So we do 4 infusions every month. And we're still doing that in a study right now for people who've had heart attack and heart damage.
Wow. And the results are comparable to doing with the catheter.
We think they might even be better.
Oh,
So
wow.
we're doing that now. We're doing 2 big studies right now, and we will have those results in the next year or so. So over the last 20 years, you mentioned my Google index. I've published a lot of PET publications. We've done a lot of rigorous studies with placebo control, and just showed you one study we'll talk about a
Yeah,
little bit
absolutely.
more next. So we've shown that the intravenous infusion is still good. There's still cases where we prefer to inject into the heart. Like, for example, if a patient needs to have heart surgery anyhow,
Hmm.
and a surgeon is in there, it makes sense to do
Quick.
the directed delivery at that time.
Interesting. Now, I'm personally very curious about this on atherosclerosis. Yeah, stem cells and atherosclerosis. Where are we at today? What is the stem cell technology? What's the latest and greatest there?
So I told you that it works really well intravenously, and it works. And before I answer that question, let me just tell you, as a result of the work with heart patients, we discovered that the cells work throughout the human body.
Hmm.
Okay, so it doesn't matter what you have, which organ is affected. An intravenous delivery is going to have a benefit to that particular organ. And we showed that from the heart patients because we were doing the injections in the heart, but we did studies that showed that the whole body got better. The patient got better. They could walk more, they felt better, they could breathe more, their cognitive function got better. The many other organs got better, even though we were trying to treat the heart. And so as a result of that, we started to do studies that for example, on patients with Alzheimer's disease who have a disease of the brain.
Hmm.
Same thing. We gave an intravenous infusion of cells, and cognitive function got better. Not only did cognitive function get better, but the function of the brain, the architecture of the brain improved relative to a placebo.
Wow.
So we've developed this idea that you could treat any number of diseases largely if they have a component of inflammation and or tissue damage, because
Hmm.
that's what the cells do. They improve the immune system function, and they remove scar tissue. We learned that from the heart.
Hmm.
If you've got scar tissue in your kidney or your brain or your kidney, also you can remove that scar tissue with the cells.
So let's talk a little bit about how your cells are a little different, right? And even you have some patents, correct, in regards to your stem cells and
Yes.
their ability to modulate the immune system a little bit better. Um, and also some of the differences, we tell our patients many times when they want to go overseas and so forth for stem cells. I honestly, I dissuade them from doing so, just because like I now in Florida, it's become more, let's say, amicable to stem cells for the right reasons. And when you're going overseas, you don't necessarily know how everything's processed and how these cells are
Right.
collected, et cetera. So maybe tell us a little bit more about your stem cells and the process and the patent and
Yeah.
so forth.
So I'll just also mention that in 2014, I created a spin-off company from the university, and the company is called Longeveron. It licensed the technology to make the cells from the University of Miami.
Hmm.
So we continue to make the cells at the university for research purposes, and Longeveron licensed the technology from the university for commercial purposes. So I've developed a significant infrastructure to to try to optimize bringing these technologies to patients who need them. And that's where the production comes in. In order to make these stem cell products in the United States for clinical use, whether that's in a clinical trial or whether it's for commercialization, the US government through the FDA provides a tremendous amount of structure and rigor around what are the quality attributes that a product needs to have. Because like any medicinal product that any doctor or patient uses in this country, at a minimum, you want to know that it's safe and that it's been properly produced.
Absolutely.
We hear all of the time about some accident or mistake. You hear all the time about this drug manufacturer had to stop producing because they had a contamination at their factory, or this product was contaminated with glass particles or something like that. The government fortunately protects us from those side effects, and if a manufacturing plant is contaminated, it will get shut down because there's monitoring for safety. Accidents do happen, and it does get through, but by and large, the supply of medication in the United States is safe because it's regulated. And so we adhere to a very high standard of manufacturing, and we adhere to a standard called cellular good manufacturing practice, or cGMP.
Hmm.
And that's introduced so we can have high quality control of what we're making, and that it's safe. We always want to make sure any practitioner, their primary objective always is to the safety of their patient, right?
Absolutely.
Yeah. So so we adhere to those very high standards, and I worry a little bit for folks who are going out of the country or getting products that aren't manufactured under those standards, that there might be either a safety issue or an efficacy issue, because you also don't know if you go to an unregulated clinic or in some country, um, you're going on faith that what you're getting contains the active ingredient, the cells. It could be that the viability of those cells is very low, or for all you know, you're getting a bag of inert material. You just don't know. So when we do our clinical trials in the United States, and when we make products available for practitioners under proper regulations, we we could stand by our manufacturing technique.
Yeah, that's a bit of my pet peeve, to tell you the
Yeah,
truth, because like in the regenerative space, and there's other therapies and so forth out there, there's it's becoming a little bit of the wild wild west. Even here,
yeah,
people with other in the peptide spaces and so forth, and I worry for patients. And so I always just tell patients, look, you want things, at least this is my view on it. You want things done in the U.S. under proper regulatory guidelines for clinical use, not for there's
yeah,
now they put other kinds of labels on certain molecules and therapies, for research use or physician
yeah.
only, which is another way that things get bypassed. But I'm really glad to see that you have put together such a strong company, and Longeveron's a publicly traded company.
Longeveron's publicly
Yeah,
traded.
so
Yes.
more, it's just not only the medical
Yeah.
scrutiny, but also on the other end, the corporate and so forth. Um, you've had to really follow along with a lot of regulatory demands, et
Yeah.
cetera. So, which is great.
Yeah. Now we have sent our products outside of the United States,
But
but they're
it's
made
made
here.
here,
So we send our
exactly.
products to the Bahamas. We send our products to. They've gone to Israel, Japan.
But it's U.S.
It's
made.
U.S. made. It's U.S. made. Yes.
Yeah, that's the whole
Yes.
point. It's
Yes.
U.S. made right here,
Yes.
which is rare, because when I'm talking to other people, I've gone overseas, especially years ago, when trying to understand stem cells and so forth, and I'm like, where are these cells coming from? And they're like, oh, our laboratories down the
Right.
street. Literally,
Right.
I got one of those, and I'm like,
Right.
laboratories down the street, right? And I'm in a
Yes.
different country, and I'm like, how do you get? Oh yeah, yeah, it's great, it's great,
Yeah.
and it's like,
See, the thing about a stem cell, it's a living human product, right? So there's got to be high quality control from the minute you identify the donor, right? So if you are getting a bone marrow donation, or let's say an umbilical cord from a woman who's just given birth, how much record keeping has been done to identify that the mom who just gave birth was healthy herself, right? So you have to. So what we do when we identify donors, and these are standards developed in the United States under the cGMP rubric, if you will. If you're doing a donor, you start with a very careful health screening of the donor. You've got to make sure that those donors don't have any virus infections or don't have any issues that you want to don't transmit. There's become an interest now in making sure that the donors haven't had certain vaccines, because there's certain people who don't want to be exposed to a vaccine. And the only way you could do that is by having tight quality control around the donor. You have to make sure that you've tested the donor and done a history and physical on the donor and done blood testing on the donor to make sure that the donor is healthy. So we do that, and we've been doing that for 20 years. We developed those techniques first in our clinical trials, and now Longeveron follows those same techniques.
Yeah, and that's actually my main argument when people are going overseas. I always say, do we know how these cells and from who they're collected, and the regulatory guidelines behind that process, et
Right,
cetera? Because I don't want to put it into my body. I
right,
really don't want to go somewhere. where this process isn't highly scrutinized and watched over,
Yes.
because I'm putting essentially somebody else's biological product
Right.
into my body, and
Right.
I want to make sure
Right.
you know.
So there's got to be rigorous quality control and rigorous manufacturing. The other thing that we do is when we release a product from our manufacturing facility, we do very high quality um, release criteria. We make sure that the cells are safe, that they're alive, that there's no infections in the material. And we also do what are called potency assays. We make measurements on the cells to make sure that they are what we think they are. So we make sure that the cells have the molecular signatures that go along with what they are, and that they're releasing the right proteins into the medium, and most importantly, that they're actually still alive.
Wow. So let's talk about some of the accolades of these cells. So such as like I remember when you showed me the patents, their ability to influence cytokines, et
Yes,
cetera, and the immune system, modulate the immune system, which I thought was wow, like phenomenal.
yes,
And then maybe discuss a little bit this new paper that you
yeah,
have coming out and the general effect of the cells on overall health, right?
yes. So what we came up with the idea about 14, 15 years ago, based on all of the work we had done on patients with diseases,
Uh-huh.
that the cells could actually modulate the aging process itself. We all know that aging is a biological phenomenon, that it's a programmed state that people are going through at different um, rates. Some people are aging faster than others, and you can look at 80-year-olds and you can have super agers who are people who are still very functional in their 80s, and you can have advanced agers who have a condition called frailty when they're 80. And you could see a dramatic difference between those two folks. And we we came up with the idea that the cells could be a very effective modulator of that. And the reason we came up with that is because of inflammation. Inflammation is a driver of a lot of human diseases and aging. So they're the common pathways between diseases and aging: inflammation, scar tissue formation, inability to restore or rejuvenate tissues. And there's a process called senescence,
Mm-hmm.
where cells become senescent and they
The
don't
zombie cells.
clear, the zombie cells, and the zombie cells trigger more inflammation. And because of the work we were doing, we could show that the cells were modulating the immune system in a favorable way and reducing the scar tissue. So that's the biological basis of why they can treat heart failure on the one hand, atherosclerosis on the other hand, Alzheimer's disease on the other hand, and even aging frailty. And it's all driven through the immune system, powerful effects on modulating scar tissue in the immune system.
So there's a term I really like. It's inflammaging.
Inflammaging. Yeah.
Which is because it's
Yes.
essentially the driving process for both,
Yes.
right? So I even like to tell our patients like, hey, your immune system is like this garden. You have to treat it, you have to take care of
Yeah.
it, make sure it's, well watered, there's sunlight. It's because once your immune system starts to go, it's by definition the process of aging accelerates, et cetera. So, and then we've spoken a lot about this in the past. I love epigenetics, and I think I personally think it's the new framework of thinking.
Yes.
Um, you've done some studies already with stem cells and epigenetics to show the process of the impact in the aging process, correct?
We haven't done as much with epigenetics as we have with inflammaging,
Hmm.
but those two are linked, and we have a repository of DNA from all of our patients, and much of it before and after treatment. So this is something we'd love to do with you as a collaboration, as a next step, is to take the samples we already have and do the epigenetic testing.
Consider it done. I
Yeah.
love that kind of stuff.
Yes.
I mean, and whatever we could do, not only to prevent disease, right? Which our country really needs that. Our country is very sick.
Yes.
We're consuming a ton of medications, treating side effects, et cetera, where we're not going for root cause. It's and something like the stem cells, which are like your original thinking on fixing the heart, right? you're actually, instead of, a pump, instead of the transplant, which they're great in
Yeah.
innovations for their time, but if we can actually fix the tissue, I mean, isn't that much more?
Yeah.
Is,
The human body has immense regenerative and reparative capability. We wouldn't be, our whole bodies are in a homeostasis. You're constantly having cells dying and being replaced. And I think, as you know, in a child, that regenerative capacity is immense,
yeah.
right? If a child breaks a bone, the orthopedic surgeon doesn't even need to set it. It's just going to heal by, it's going to find a
Hmm.
union and heal by itself. In an adult, you got to have a plate put in for the same kind of fracture that a child would heal on its own. So that innate reparative ability is there, and it's lost over time, and it's lost at different rates. So what we think is happening with the stem cell infusions is we're restoring the body's own ability to heal itself to an earlier stage.
Wow.
And if you could do that, because your whole health is based on continual rejuvenation and replacement of tissues.
So with that, I have to ask you, you just prompted me here. There's a bunch of doctors, or a small group of doctors, health influencers, and people in research, etc., that claim that, or talk about the longevity escape velocity, that we're either the last generation to die or the first one to live forever. What are your thoughts there? Just because that, that they talk about the jellyfish, there's a certain type of jellyfish that
Yeah.
does it, it's immortal, etc. Um, how far do you think we're from actually achieving that, and do you think we'll ever achieve it at all?
You know,
And I know it's a far
the
out
problem with
question.
prediction is it's very, very difficult, especially if it's about the future.
Great answer. Great answer.
So, I think that um, I like to think about what's already happened
Hmm.
and and focus on the actual tangible facts that we have. Here's what we do know. Okay, we know that human lifespan has doubled in the last 120 years.
Yes.
Okay, the average mortality in 1880 was 41 years of age, and now it's above 80. And mathematical modeling and prediction does predict, and again, it's a prediction, so we don't know for sure, but that the average death rate might be average lifespan might be about 120 years by the end of this century. So it's certainly continuing to grow, and it's predicted to continue to grow. I think the more important target for the people who are alive, us in this room, is how to make whatever time we have the highest quality. Because what we've learned and what we understand is that even though human lifespan has doubled, that doesn't necessarily mean that health span has improved. Health span is the term that relates to the quality of those years, right? So what we know is that the longer a person lives, also the longer the period of poor health span is. So our target in our work has been to see if we can improve health span. We'd like, however long you're destined to live right now, we want to help make your time be the highest quality of health. So if you're going to live 80, 90, or 100 years, or maybe even 110 in our lifetime, we want to make sure that you're not in a nursing home for the last 15 to 20 years of your life.
Absolutely.
Right. So so those extra years are only meaningful if you have normal full function and can enjoy those years and be a productive member of society and have a real life. So that's where I think all of the longevity field, the health span field is really focused, and I think that's the right focus. Um, there's an X Prize right now that's out there. One of the biggest X Prize awards is going to be given to the group who can show an improvement in health span.
Right.
And we're part of that. We're going to be testing ourselves um, in the X Prize to see if the cells improve health span. We already have data. We just published a paper that'll be online on February the 25th in the journal Cell Stem Cell, where we showed many markers of health span improvement. One of the best and easiest markers of health span improvement is a very simple test that anybody can do, which is to measure how far you can walk in 6 minutes.
Hmm.
The amount of ambulation and the amount of walking that a person can do in 6 minutes is correlated with how their health and how long they're going to live. And we showed that an infusion of the mesenchymal stem cells increased the 6-minute walk test significantly and in a dose response fashion in people of an average age of 75 years of age who had inflammaging and who had a diminished walk ability at baseline.
Wow. So yeah, that concept of health span and lifespan, I'm big at Biohax, our company, in
Yeah.
measuring this and discussing this with patients. Sometimes patients come back. We do it through epigenetic testing with a company called TrueDiagnostic.com. I personally think they're by far the best out there. And sometimes patients get upset. They're like, "Wow, I want my health span and I want my lifespan." And I'm like, "Well, hold on." I'm like, "Hold on, let's discuss this, right?" And it's so interesting how stem cells um, are a huge pillar in my view of aging and age gracefully and health span, etc. How stem cells are a huge pillar, if not the biggest pillar, in the technologies we have today
Yes.
for that
Yeah.
longevity escape velocity, which I'm like you know, I think it's a bold a bold goal, but God bless the industry and let's all keep pushing. But I do think stem cells are the future,
Yes.
and it'll be a must. I do imagine a United States one day where we will be treating our patients with stem cells for various indications all over the country, not just in certain geographical regions, which have allowed it for certain reasons, but even aging. Aging, I think, is the ultimate disease that needs to be treated,
Correct.
and stem cells are in the forefront.
From a public health standpoint, if you can treat aging and improve health span, it will have the biggest impact on overall health of Americans uh, that's imaginable. And I say that because of what's known as the geroscience hypothesis. If you look at epidemiology, we always try to get clues to health based on epidemiology. That's how we discovered that smoking causes heart disease. You could look at, this was a very famous study done in Framingham, Massachusetts, where they followed people over a long period of time, and they looked to see who had a heart attack, who was at a higher risk of heart attack. People who smoked had a higher risk of heart attack than those who didn't. And so it became logical to advise people to stop smoking, right? It makes sense. If you look at the epidemiologic risk of age, the older you are, your risk of getting other diseases becomes hyperbolic. The risk of being 80 versus smoking is so much greater just by being 80. Okay. So if you think about that, age is the biggest risk factor for all other diseases. So it's not only something that impairs your quality of life through frailty and other conditions, but it also places you at the greater risk for other diseases like heart disease, cancer, stroke, Alzheimer's disease than any other risk factor you can have. So there's huge merit in trying to treat aging, right? Not only is it going to make you feel better and live longer, but it's also going to potentially prevent you from getting other comorbid diseases.
And I know what the listeners are thinking, forgive the colloquialism, but crap, I'm getting older. And yes, exactly. We're all getting older by
Yes.
the second, and it's actually a great thing. It means you're alive. But the whole idea, I like to say this, is to die as late as possible, as young as possible.
Yes. Yeah.
And that's health span,
Yeah.
good quality of life. And Dr. Hare, I know we could keep talking here and I can keep picking your brain for hours. And that's why you're my personal friend. And sometimes I give you a call and ask you some questions. But it's been an absolute pleasure. And for the listeners today, I want you to understand you can take control of your health. you can take control of various aspects of your health. And for that, you need data, you need good diagnostics, you need good health professionals, and you need to understand the latest technologies that are done correctly. And today we had the pleasure of speaking with Dr. Hare, in my opinion, the best in the world at stem cells. And I have to say, in the name of all the medical community and the planet, thank you for your work that you have done in stem cells. And it's funny, I've picked up books that I'm reading on stem cells, and the book starts by thanking a bunch of different scientists that have contributed to stem cells, and your name's first. And I've showed you this before. I'm like, hey, you know you're in this book. It's like, oh no, I didn't. Just so you guys understand the level. So I think we have to finish this podcast today by thanking you for all the work that you've done, and I know you will continue to do. And thank you for gracing me with your knowledge all the time. I really appreciate you, and I appreciate your time with me
It's a
today.
pleasure, and let's keep fighting this fight and helping to improve the health span of our society. There's huge, huge benefits and dividends that will come from that
Absolutely.
for
Absolutely.
everyone.
God bless you all. Stay healthy. Take care of your health.